Hi, how are you? This is Dr. Kim. So today a student brought this radiographic case to my attention, and his question was, what is this uh, opacity in the right maxillary sinus? He was particularly concerned that the patient was recently diagnosed with cancer, and he just wanted to rule out any signs of metastatic disease. As far as I know, patient was asymptomatic, no sinus-related symptoms, and we decided to look at this case together. So when I looked at this case, let's see if I can change the contrast a little bit. Overall, he had a question not only this, but also this area as well. So there were a couple things that we were able to clarify right away. First thing was this opacity right here. You can see this border, and it appears to extend posteriorly. Let's see if we can bring out its border a little better. So right here, it extends posteriorly, and although I'm unable to trace it clearly, but I know from anatomic information it's going to have to move or extend in this AP direction. So this represents the inferior turbinate. The question is then, why do we not see on the patient's left side? And that's partly because there's a rotation of the patient head in the imaging, and it could also be due to the fact that the size of the turbinate's not always symmetric. So this could be larger, hence may appear better, and this turbinate could be smaller and hence not as discernible on the panoramic radiograph. And additionally, we were able to recognize, we had to recognize a couple other anatomic landmarks. So this is the zygomatic process of the maxilla, and that's the posterior wall and floor of the maxillary sinus. So again, floor and posterior. And here's the border of the orbit, or you can say roof of the maxillary sinus. Another thing that I identified was right here. This is infraorbital canal. You can see that same feature on the other side. So infraorbital canal carrying infraorbital nerve. Having identified all of that, we still had a little bit of, or I had a little bit of difficulty determining this border and that border. I like the fact that this, whatever this is, it wasn't causing any erosion or destruction of the surrounding bony landmarks that as far as I could identify. And but one thing that was obvious is it had a density of soft tissue. It did not have hard tissue density, and it just kind of looked suspended up in the air. So initially I thought, well, this could be patient just kind of soft tissue that was captured as a result of patient's head being rotated during the image acquisition. But thankfully, the student remembered that we had a CBCT taken on this patient. So I'm going to bring that up, and that pretty much answered the question for us, gave us the definitive diagnosis. So here's the CBCT scan of that patient. I put my crosshair right over the area of interest. So just to help you get oriented, we're looking at the coronal image and the axial plane, and here's the sagittal plane. Here's that floor of the orbit, or the roof of maxillary sinus, and this canal that you see, you can actually follow that canal, right? That there it exits, right? So that's the infraorbital canal. Here's the medial wall, and there is a floor. Likewise, on this axial plane, here's the anterior wall. You can say anterolateral wall. Here's a medial wall. You could say this is either posterior or posterolateral wall of maxillary sinus. So that's is what we see, what we saw on panoramic radiograph. A well-defined, round radial opacity that's been suspended, kind of suspended by the roof, on the roof of the maxillary sinus or the floor of the orbit, and draping down inferiorly along the anterior wall of the maxillary sinus. So in the sagittal view here, you can see that's the anterior wall of maxillary sinus, and that is the dome-shaped opacity we saw right here, and that's the infraorbital canal. So this is mucous retention pseudocyst. So it posed a little bit of a radiographic challenge for us initially, because many times this mucus retention pseudocysts typically reside on the floor of the maxillary sinus, giving us that very characteristic appearance of a dome-shaped opacity sitting on the floor of maxillary sinus on panoramic radiograph. But here on pan, you saw just kind of opacity that appears to be just like suspended just up in the air in the middle of maxillary sinus. And that's why it was a little bit more confusing. But looking at the cone beam CT, we know, yes, there is a mucus retention pseudocyst along the anterior wall of the maxillary sinus, extending all the way to the roof of maxillary sinus. So yeah, again, the more you see cone beam CT images, you will realize that it actually makes diagnosis a lot more fun and perhaps easier in many cases, because you have an actual anatomic data, whereas again, going back to that image, it's a superimposition of three-dimensional anatomic structure. And when you do that, there's always you create a superimposed image that can be more difficult to make a proper diagnosis. So, well, before we finish, I want to show you the turbinate. So, inferior turbinate is right here. Let me bring my crosshair. So, from this sagittal view, now that the shape of this turbinate looks very similar to the one we saw in panoramic radiograph, right? And that turbinate, it can be also seen here as well. And it does appear that the left turbinate is a little bit smaller than the right side at the time of this image acquisition. But keep in mind that these turbinate sizes change all the time, even during within a day. So just keep that in mind. So again, I hope this was interesting, and I'll see you in the next video. Thank you.